Welcome to the recorded version of the Grantmakers in Aging web seminar, Building the Business Acumen of Community-Based Organizations for Successful Healthcare Partnerships, featuring Marisa Scala-Foley, Social Science Analyst with the Administration for Community Living, Erin Westphal, Program Officer with the SCAN Foundation, Nora OBrien-Suric, Senior Program Officer with the John A. Hartford Foundation, and John Feather, CEO of Grantmakers in Aging, from May 12, 2014. This event was made possible by a partnership between Grantmakers in Aging, the John A. Hartford Foundation, and the SCAN Foundation. Technical and production support is provided by the American Society on Aging.
Thanks so much, Steve, and welcome to all of you who have joined us today for this very important session on building the business acumen of community-based organizations for successful healthcare partnerships. As Steve mentioned, I'm the CEO of Grantmakers in Aging, and I'm delighted that so many of you have joined us today. Before we begin, I want to thank those whose support has made today's webinar available free of charge to our audience. The John A. Hartford Foundation of New York provides continuing support for this series, and the SCAN Foundation of Long Beach, California is supporting this particular program. I also want to thank the expert team at the American Society on Aging for providing technical and production support for the series. Certain provisions of the Affordable Care Act, such as models to integrate care for those eligible for both Medicare and Medicaid, the often called dual eligibles, and a push for care transition programs, offer new opportunities for community-based aging and disability service providers to contract with healthcare organizations. Yet many of these community organizations lack the necessary business acumen to do so. Foundations throughout the United States, as well as the U.S. Administration for Community Living, have initiated programs to assist these organizations to overcome some of these challenges. In today's webinar, our presenters will highlight different approaches to building the business acumen of community-based organizations. We are pleased to have national leaders in this effort to help us better understand the opportunities and challenges. Marisa Scala-Foley is Acting Director of the Office of Policy Analysis and Development in the Center for Disability and Aging Policy at the U.S. Administration for Community Living. Erin Westphal is Program Officer at the SCAN Foundation, and Nora OBrien-Suric is Senior Program Officer at the John A. Hartford Foundation. And I welcome you all. As we move to the next slide, Marisa, let's start with you. What do you see as the opportunities to better integrate services for older persons?
Thank you, John. So we're really thrilled to be here with you all today. In terms of the opportunities to better integrate care for older adults, and I would also add persons with disabilities. The Affordable Care Act and other efforts that are going on within states around the country offer numerous different types of models for integrating care, some of which states are participating in, and others of which states are not participating in. But all of these are present in nearly every state around the country. So you see a variety of different types of models in the slide here on the screen in that sort of wheel that you see. And some of these you all may be familiar with, and others you may not be. But they include things like accountable care organizations, which are part of the Medicare Shared Savings Program, the Community-Based Care Transitions Program, or CCTP, which was a provision under the authorized under a provision under the Affordable Care Act, and really seeks to improve transitions for people with Medicare going from hospital to home. What's called the Dual Financial Alignment Initiative, which is also being run out of the Centers for Medicare and Medicaid Services, as are pretty much all of these efforts, and the Duals Initiative seeks to integrate care for people who are dually enrolled in both Medicare and Medicaid. As well, the state innovation models, which seek to integrate care and improve care across payers, and a couple other efforts under Medicaid health homes, and Medicaid managed long-term services and supports. So there are a lot of opportunities there, I think, to integrate and hopefully improve care for older adults, and lots of opportunities for community-based organizations to get involved.
So as we go to the next slide, if we are trying to improve health outcomes, why is focusing on chronic care and functional limitation so important?
Well, all of these efforts that I laid out on the previous slide really seek to achieve what is called the three-part aim of better care, improved quality of care, better population health, including for older adults, and especially for older adults on some of these, as well as lower cost. And if we're looking for all of that, as you'll see on the screen, you've got a small segment of the population that's highlighted there who have both what chronic conditions, things like high blood pressure or diabetes and so forth, but also have functional limitations. So they may need assistance with things like bathing or dressing and so forth. But you'll see while it's a relatively small segment of the population in that pie chart on the left, they consume a much larger percentage and proportion of healthcare services, and not surprisingly have much higher healthcare costs. So if we're really looking to do hit all three of those aims, working with people with chronic and functional limitations is going to be critical to all of this, and that is a population that we believe that community-based organizations specialize in working with.
So as we go to the next slide, what is the connection then to community-based long-term services and support?
So sure. So one of the efforts that I had laid out on that very first slide, which had that sort of wheel, talked about the community-based care transitions program, and care transitions and avoiding preventable hospital readmissions is a key. Really a key marker that a lot of these programs are trying to achieve, because it's a way to not only improve care, keep people out of the hospital where they don't want to be, and also to really save money and have lower healthcare utilization costs. So one of our programs, but what we know is when people leave the hospital, they often don't just need sort of a short-term coaching intervention to help them get through the next, 2 weeks or 30 days, but they may need long-term services, longer interventions, so connections to long-term services and supports, or LTSS. And that may come up during these transition periods where they're going from hospital to home or even from nursing facility to home. So the data that you're seeing here on the screen come from the Aging and Disability Resource Centers, or ADRCs, that the Administration for Community Living funds. And you're seeing data from a 6-month period, I believe in 2013. And what this is just meant to show is the breadth of services to which people were connected by their Aging and Disability Resource Centers when they were coming out of the hospital. So it includes things like CDS&P, which stands for the Chronic Disease Self-Management Programs, which can help people to self-manage some of their chronic conditions, falls management and prevention, medication management, which we know is critical for people coming out of the hospital, as well as nutrition services, caregiver support, personal care, transportation to medical appointments, and more. So there's a lot that can be done during that transition period, and it offers a lot of opportunities, again, that we think community-based organizations can really help to fulfill and improve the quality of care for older adults and their families.
As we go to the next slide, then, community-based organizations, of course, have been the backbone of both the aging and disability service systems for many decades. Where do they fit into these integrated care models?
So we think, at ACL, we think there are a variety of roles that community-based organizations, or CBOs, can play in these integrated care models. And the first of which is working with their state, potentially in an outreach or education or advocacy role. That might include things like assisting consumers with selecting plans. For instance, many of the states that have executed memoranda of understanding with the Centers for Medicare and Medicaid Services, or CMS, related to Dual's Financial Alignment Initiative, many states are doing what is called passive enrollment, which means that unless they hear from someone, someone with regard to a choice of a health plan, particularly under models that use capitation or managed care under all of this, unless they affirmatively hear from a person that they want to be enrolled in, XYZ plan, they are automatically enrolling them in a plan. So we think there's a role for community-based organizations in helping consumers and their families with selecting the plan that's right for them. We also think there are roles with regard to monitoring the quality of care that may be provided to older adults and persons with disabilities under a variety of these types of programs. So things like secret shopping, which is something that SHIPs or state health insurance assistance programs did or have been doing with Medicare Part D plans in past years. And finally, in terms of an outreach or advocacy role, we also think there's a role that community-based organizations can play with regard to individual complaint resolution. So, we all know that problems may happen with regard to getting access to care and so forth. As much as we will try to avoid them, things come up where consumers need assistance with and may have complaints about the care that they're receiving or the service that they're receiving. And those can help to be resolved by what are called ombudsman programs. And many community-based organizations, particularly within the field of aging, have already been doing this role with regard to long-term care or nursing home ombudsman in a variety of different states to help with complaint resolution. And we also think that there could be a role for community-based organizations in doing some of that complaint resolution with regard to these integrated care models that are coming up. And in fact, CMS, in partnership with the Administration for Community Living, have put out a request for proposals from states that have been approved for the Dual's Financial Alignment Initiative in setting up ombudsman programs to work with their clients who may be enrolled in the Dual's Financial Alignment Initiative in that state. So we are starting to work not only with CMS but also with some of these state ombudsman programs that have that particularly deal with duals in the Financial Alignment Initiative. So those are just a couple of examples of roles there. If we could move to slide 6. Where
we'll remain with that same topic. That's quite a lot. And so what are some of the other developments you see in integrating CBOs into the provider network?
So where we've been really at ACL, and I know our partners at the SCAN Foundation and the John A. Hartford Foundation have been really working very closely with community-based organizations, has to do with contracting with integrated care entities. And when I talk about integrated care entities here, we're talking about a variety of different types of organizations. It could be hospitals. It could be health systems, what you heard me refer to before, accountable care organizations or ACOs. It could also be health plans or managed care plans when we're talking about integrated care entities. But we believe that some CBOs, not all CBOs, but some, may be able to contract with integrated care entities to become part of their long-term services and supports provider networks. These community-based organizations are working together to offer packages of services such as care or transitions management, which we talked a little bit about earlier, assessment, options counseling or person-centered planning, chronic disease self-management programs, and other types of evidence-based programs such as falls management programs and so forth. Nutrition, transportation, caregiver support, and more. But one of the things that we believe at ACL and what we've heard as we've been engaged in conversations with health plans is that there may be a need for more formal network building at the community level in all of this. Because what we've heard from health plans is that repeatedly is that they don't necessarily want to contract with dozens or hundreds of community-based organizations within a given area, within a given service area. And so they're more looking for sort of centralized contracting, where they'll contract with a single organization or a couple of organizations that can help them put together their long-term services and supports provider network. That also can offer advantages to community-based organizations, not only when it comes to that specifically with contracting with integrated care entities, but it can also help them to expand their geographic reach. And also off what we've heard from some area agencies in particular that have engaged in this work, it also can offer them economies of scale with regard to common business functions like human resources and purchasing health insurance and so forth. So we think there can be advantages with regard to those more formal networks at the community level on a variety of different fronts.
So as we move on to the next slide, where do these existing networks best fit into the new models?
So we think there's a lot of value that aging and disability community-based organizations can add to these integrated care models. So what you're seeing on the screen are things that we know are really of interest to health plans and other integrated care entities when it comes to working with their members. So you'll see in the boxes that are sort of on that wheel things like managing chronic conditions, activating beneficiaries, making sure that consumers and their families are really engaged in their care. Things like diversion, avoiding long-term residential stays, long-term nursing facility stays, which we know can be extremely costly, more costly than keeping people in the community in their own homes where they prefer to be anyway. And also, as we talked about before, we know that one of the quality markers for a lot of these integrated care entities has to do with preventing hospital readmissions and also admissions to begin with, which, again, not only detrimental for the person themselves who's going into the hospital and their families, but also, extremely costly, not only to the consumer and their family, but also to the plan and the system in general. So we think that our networks can add value in all four of those areas. And you see examples listed by each of those boxes in terms of programs that we know that aging and disability organizations have been engaged in in some cases for decades. In others, they're a little bit newer, but that can really target some of these and add value and help integrated care entities to meet their quality benchmarks. So just taking one of these, for example, managing chronic conditions, the box at the top of the wheel. So here are examples of some programs that community-based organizations have engaged in and really have offered that can help with help plan members or people who are enrolled in integrated care models to manage their chronic conditions. So area agencies on aging and other aging services organizations have been engaged in using the Stanford model of chronic disease self-management. Some have been approved as Medicare providers of diabetes self-management training and self-management services. In addition, many, as we know, one of the backbones, of the aging network in terms of service provision under the Older Americans Act is meal provision as well as nutrition counseling. And finally, many area agencies on aging and other aging and disability community-based organizations over the past several years have also been engaged in education about the Medicare preventive benefits, again, which can also help people to manage their chronic conditions. So for all of these areas that we know are of concern to health plans and the like, we think that there are ways that our networks really can be engaged and help to achieve that three-part aim of better care, better health, and lower cost.
As we go to the next slide, then, where's your agency, the Federal Administration for Community Living, investing?
So we really see this as a critical area for our organization in terms of really building the business capacity, not only of community-based aging and disability organizations, but also states to be active stakeholders and partners in terms of improving the quality of care and really engaging and and implementing integrated care systems. So we've been working in a variety of different areas, which I'll talk about. So a couple of years ago, we gave grants to the National Association of Area Agencies on Aging, or N4A, as well as the National Association of States United for Aging and Disability, or NASHUID, to provide training and technical assistance for the aging and disability networks on issues related to integrated care, and also to assess how the aging and disability networks have been involved in these systems. So we've been working on that for a couple of years with those national partners. But as a result of that work that we've been doing with those two national partners, we also realized that not only those two organizations, but also other technical assistance providers whom we work with and who have grants or contracts with ACL, we're also touching this issue of how you build business capacity and how community-based organizations can market their services to integrated care entities. And we also saw a need for really not only this broadband technical assistance, but also really focused or targeted technical assistance to smaller groups of community-based organizations, as I mentioned before, networks of community-based organizations that were interested in contracting with integrated care entities. So now, just about a year ago, we went out with a request for applications that really did not offer grants. We're not, in fact, providing any funding to these community-based networks, but rather what we did was put together a learning collaborative of networks of community-based organizations that were interested in receiving technical assistance, that were interested in contracting with integrated care entities, and really wanted to receive some both one-on-one and group technical assistance to help them achieve that aim of contracting with an integrated care entity. So we've been working with 9 networks now of community-based organizations, all of whom share that goal of achieving at least one new contract with an integrated care entity within calendar year 2014. And it's been really exciting work. And this business acumen work, as you'll see in the final point on this slide, has really brought us together in terms of working with philanthropic partners like our friends at the SCAN Foundation and the John A. Hartford Foundation, who I know who will be speaking next, as well as with grant makers in aging and other entities, really to coordinate our activities wherever possible, to leverage resources and to share learnings, because we're learning a tremendous amount in the work that we're doing, not only sort of in those national grants, but also in that more targeted technical assistance.
Well, as we come to the last slide then, this is all very exciting work. Could you tell us a little bit about where the collaborative networks are and a little bit more, anything else you'd like to add about the collaborative networks?
Sure. So we, as I mentioned, we ultimately selected, we received a few dozen applications. We ultimately selected 9 community-based networks around the country to work with in this learning collaborative. You see the list of the networks who are part of that learning collaborative. So there are 2 in California. The first one is led by the Partners in Care Foundation. The second is led by the San Francisco Department of Aging and Adult Services. We are working with the Healthy Aging Regional Collaborative in South Florida, the Elder Services of the Merrimack Valley in Massachusetts, the Senior Alliance and Detroit Agency on Aging in Minnesota, the Minnesota Metro Aging and Business Network, which is in the Minneapolis area, the Area Agencies on Aging of Erie and Niagara Counties in New York. Our Pennsylvania effort is a statewide effort, and we're working there with the Pennsylvania Association of Area Agencies on Aging in partnership with the Pennsylvania Centers for Independent Living. And finally, our Texas network is led by the North Central Texas Council of Governments, but interestingly, they are also working extremely closely with the Texas Department of Aging and Disability Services. So there's a really nice collaboration there between not only the state unit on aging and disability with community-based organizations in terms of contracting with health plans. And we are, as I mentioned, we're learning a tremendous amount in this work as one of our partners at the Partners in Care Foundation, June Simmons, often says we're building the plane as we fly it. So we're learning a lot from them, but we're also feel and have we've learned a lot from them, and we hope that and we know from what we've heard that they feel like they're gaining a lot from the technical assistance that they're getting from the resources that we've been able to marshal. And with support from the John A. Hartford Foundation, we've actually been able to bring the sites together for an in-person meeting a couple of times a year. We had one in the fall. We're going to have another one in several weeks, where the sites can not only meet face-to-face, but really brainstorm about the challenges that they're encountering in this really important and timely work, and also share successes. So we're thrilled with the work that's been happening at the local level and with the learnings that they've been able to share as a collaborative.
Well, thank you so much, Marisa. This is very important information for us, and it sets the tone for the rest of the session. As we go to the next slide, there's an information about the contact for Marisa and also the agency. Before I move to our next presenter, I want to remind our audience that we will have time for questions at the end of the sessions. We will need for you to provide these in writing, so if you go to the question box on the right-hand side of your screen, you can enter those at any time, and I will be reading those to our presenters later. So as we go to the next slide, Erin, let's bring you in next. And then if we could go then to the next slide, Linkage Lab is a specific example of capacity building in this area. Can you describe Linkage Lab for us?
Absolutely, and thank you for having us as a part of the webinar today. The goal of our Linkage Lab project is to implement models of care that link the medical and community-based services in California by supporting the development of contractual relationships between these two sectors. We see real opportunities in a number of the areas that Marisa pointed out on her first slide, specifically around the duals demonstration here in California. We're also working with a number of organizations that are part of the Community-Based Care Transitions program to do this work. In total, we have 6 organizations that over a 24-month period are working towards 5 main objectives, which are on the next slide. Their goal is to really do a deep dive as an organization to evaluate their current infrastructure and to make adjustments and changes so that they can be prepared to move from really an organization that relies on grants and other sources of funding to run more like a business and be able to really articulate the costs, the service delivery, and show outcomes. The second is to think about what is it that they do best as an organization, what are the needs of their potential partners, and to develop a service package that leverages that. This often includes care coordination and care transition services. And once they understand what that package should look like, then working to develop a pricing for those services and a robust business plan and business model. Most of the times the organizations can talk to you about a reimbursement rate they get for a certain unit of service, but through this process and being able to stop and to think about, well, what is the true cost for our organization to provide this service? If we were going to provide more services, would our costs increase because we may need to hire staff, is an important component. Then they're working towards building those relationships and marketing their services to new payers for these contractual relationships. And that 5th objective is to create these formalized relationships.
If we can go to the next slide then, what have been the outcomes for the Linkage Lab program so far?
Well, they've done some tremendous work. They've been working with 2 technical assistance providers, one that's providing what we're calling a mini MBA, and the other that's providing hands-on in-person technical assistance. And through this work, they've really transformed as organizations for both achieving the objective of evaluating their current infrastructure and operations and making adjustments, to working with staff who are building their individual skills so that they can do this work. And through the technical assistance piece based on that education, we're really pleased to say that these 6 grantees have now established 15 contracts with the healthcare sector. Some of these are still due to be implemented. For example, under our duals demonstration in California, we've had some delays. But the contracts are in place, and the organizations are feeling really confident about the contracts they've developed and the rates they've negotiated. And I think one of the really amazing pieces has been how the leadership of these organizations have helped with changing the culture of the organization and supporting the change. Many of the people that work in our sector and other nonprofit sectors have come into this work because they want to make a difference and they want to help people. And engaging in building business acumen and developing relationships with payers where you have to be outcomes driven and show results. And we've even heard about some partners wanting people to share risk for outcomes. This really presents a different way to think about how you do the business. And so that culture shift within the organization has become a really critical piece.
Well, thank you for that explanation of this great example of how to move this forward. Before we have our next presenter on the next slide, I want to remind you once again that we are looking for your questions. Just open the question box that you have in front of you there, and then write your questions in, and we'll be asking them at the end of the session. So, Nora, let's have you join the conversation as a funder of this effort, along with SCAN and other funders. And on the next slide, how does this work fit into the mission of the John A. Hartford Foundation?
Well, hi, John, and hello, everybody. Glad to join you all. So this work, the mission of the Hartford Foundation is to improve the healthcare for older adults and through a comprehensive, coordinated, and continuous geriatrically expert services. So we feel that this project works very well within our mission because it is, we believe, going to improve the health and independence of older adults by bringing the social services into the equation with the medical services so that you can provide a continuous services of care delivery from the hospital to the home and providing long-term services and supports in the home to help keep people living as independently as long as possible and out of the hospital.
On the next slide, what are the objectives of this work?
So in order to do this, we are going to provide support to develop 2 prototype social service agencies in order to develop a coordinated network. So much like how Marisa described with the ACL, it's bringing a continuum of services in the community together to work collaboratively as one entity and then partner with the healthcare system. So we're providing funding for 2 prototype social services networks to develop the prototype of, bringing them all together, developing the business contract. So this is the product lines. So what are the templates for developing the contracts, not only among the social service agencies in order to work collaboratively together, but then as one entity to collaborate with an accountable care organization or a managed care organization. So they'll be developing templates, product lines that can be shared not only with each other, but also with other communities who will be doing this across the country. And part of this is really to learn as quickly as possible. So what's working, what isn't working. So it's a rapid cycle learning and evaluation process so that we can understand, what types of partnerships are going to work and what won't work, and then how to develop those partnerships so they can be supportive of each other as well as with the medical community and in particular to help each older person in the community. So the other objective is then to build a national technical assistance structure, and this is with the ACL. So just as you heard it being described that there are 9 sites across the country that are being supported by technical assistance with the Administration for Community Living financing. So these 9 sites are the Learning Collaborative, and they're developing a technical assistance structure. So the Hartford Foundation is providing support in order to bring these 9 sites together in person. Because as you heard, the funding is for the technical assistance experts, but not exactly to each of the 9 sites. So when the Hartford Foundation found out about this, and it just so happened that we're funding 2 of the 9 sites, we thought it would be really advantageous to bring all 9 sites together once a year in order to learn from each other, to share experiences.
As we go to the next slide, what specifically are you funding at this point?
So specifically, we began working first with the Partners in Care Foundation out in California, and they are developing a regional network in the Southern California area, bringing community-based organizations together in that region, in Los Angeles County and in Orange County, to work as one entity and then to contract with accountable care organizations and healthcare systems. And so specifically what they're doing, so they'll be providing short-term in-home interventions and also evidence-based self-management programs and also long-term services and supports there. And it's being led by the Partners in Care Foundation. And then we're working with, and I think that cut out, it's the Elder Services of the Merrimack Valley in Massachusetts. And they're actually developing a network of services throughout the entire state of Massachusetts that are going to be providing evidence-based practices programs that will then contract with physician groups, with healthcare entities in order to provide that continuum of care. And then, as I said, the third component of this is working with the Administration for Community Living in bringing the 9 sites together once a year in order to learn from each other. So those are the 3 funding components.
Well, on the next slide, you've already mentioned a little bit about the Partners in Care model, but could you describe it in a little more detail?
Yes, thank you. So, as I said, so they'll be providing short-term in-home interventions, the evidence-based self-management programs, and long-term services and supports. What Partners in Care Foundation have, they've got several care transition programs. They're also working with the duals programs in California. They are leading the Evidence-Based Leadership Council, so that's in helping to implement evidence-based practices into community-based organizations. And they'll be implementing their Home Meds program as well, which is what the Hartford Foundation helped fund several years ago, which is helping to coordinate the medicines for community-based older people to help keep them out of the hospital. And we're really proud that the Archstone Foundation is our funding partner in providing this leg of the component that we're funding with Partners in Care. And the Archstone Foundation is also providing support for their Evidence-Based Leadership Council as well. So we're really proud to be partnering with them on this.
On the next slide, then, how about the Massachusetts state model?
So as I said, so the Elder Services of the Merrimack Valley are providing, it's a statewide network using chronic disease self-management programs, and they'll be partnering with physician entities and accountable care organizations in providing these evidence-based programs, and they've created a hub, a network of hubs across the Massachusetts region. And we're really proud to be partnering with the Tufts Health Plan Foundation on this as well.
Great. On the next slide, then, how are you working with the Administration for Community Living?
And as I mentioned, it was just very serendipitous that the Hartford Foundation started working with the Partners in Care Foundation and then found out that Elder Services of the Merrimack Valley was doing something similar. So as we were working on developing the proposal with these 2 entities, we found out that the Administration for Community Living was putting out their request for applications for 9 sites to receive the technical assistance in developing business acumen. So this fit in really nicely with what we wanted to do with the Partners in Care Foundation and Elder Services of Merrimack Valley, and helping them develop their business acumen and developing the templates that can be shared with other community-based organizations across the country. So we thought, well, let's partner with the Administration for Community Living in helping to support the 9 sites in coming together, convening, and developing that national technical assistance model. so that all of these 9 sites together will share their learnings, help share and perfect the products that they're developing, and share the resources. And then they'll be sharing this across the country with the website that is being developed through the National Association of Area Agencies on Aging.
So as we come to our last slide then, how do you define success for this project?
So the Hartford Foundation really relies on building upon the strengths of the social service agencies. I mean, they've got the expertise. They've been providing, high-quality social services for decades, and they are the trusted experts in providing care to older people in the community. So in developing upon those strengths and helping them to adopt the new skills in order to integrate with the medical systems and providing a continuity of care, we believe that we will then have success in meeting that triple aim of providing quality care, reducing the cost, and increasing patient satisfaction. And what we're expecting, each of our 2 sites that we're funding, in addition to the other sites, as Marisa had said, is that each of these 9 sites, including the Partners in Care Foundation and Elder Services in Merrimack Valley, will have at least one partnership contract with a medical healthcare system within this first year of funding. And we really believe that this is something that all foundations can participate in, and that's why I'm so glad that we're having this webinar right now, and we've invited all the other foundations and in order to learn what we're doing. There are other foundations that are involved with this, such as the Health Foundation of South Florida, the Health Foundations of Western and Central New York, and the Altman Foundation in New York City, who have found ways to help all of the regional and the local community-based organizations to succeed in this area and building on these successes. So the Hartford Foundation is really excited to be working in collaboration with the SCAN Foundation, with the ACL, and with these other foundations that I've mentioned, and really focusing on how we can strengthen community-based organizations so that they can come together and provide that continuity of care in order to keep the older adult and those people with disabilities in their homes for as long as possible. So thank you
so much, Nora. We now wanted to turn to all of your questions. We have a number of questions already, but if you'd like to have us ask a question, please write it in the box that you see on the right hand of your screen. Just open the question window and type it in. So the first one I will direct first to Marisa, but our other participants can say as well. And it has to do with these are wonderful programs and wonderful networks, and so where do you go for guidance if you're a community-based organization but you're not part of one of these wonderful networks that has been set up? Where else can resources be found?
Sure. So I think, one, I really would encourage wherever for community-based organizations that happen to be in the areas, and I'm happy to provide more specifics to anyone who's interested. If you want to email me, I'm happy to provide more specifics about networks in the states that I mentioned. But for those who are not, the technical assistance that the National Association of Area Agencies on Aging, or N4A, and NASHUID, the National Association of States United for Aging and Disability, are really, those grants are meant to be sort of broadband technical assistance offerings. I know the webinars that N4A offers to community-based organizations are open to anyone who wants to register for them. They also have a weekly managed long-term services and supports update that I know we personally at ACL find to be incredibly helpful, that talks about what's happening in different states with regard to managed long-term services and supports. That is free and open to anyone. They've also developed a website, and that URL is www.mltssnetwork.org. And again, that's www.mltssnetwork.org. That has lots of great resources that are available for free to community-based organizations around the country who may not be part of these networks. You can also sign up for that weekly update that I mentioned and for updates related to webinars that they may be offering and so forth. In addition, all of the webinars that we have offered to the networks that are in our Learning Collaborative are also publicly available on the acl.gov website. If you look for on that website, and I'm happy to send a more specific link to that. It's a little too long to repeat here and confusing to repeat here over the audio line, but I'm happy to email that out. And John, you can advise us as the best way to do that. Or folks, if folks want to email me, you have my contact information in the slides. I'm more than happy to connect you to that. But if you go to acl.gov and look for the Center for Disability and Aging Policy, you'll see our office listed there, and it's buried a couple levels down, but it's not that hard to find. But like I said, I'm happy to email that specific link to folks who might want it.
Thanks very much. Erin or Nora, anything to add to that?
Hi, this is Erin from the SCAN Foundation. And, I think that that's a really great question about how community-based organizations can have access to additional information, even if it's just that where they are along the spectrum, if they're just starting to engage in this work or pretty far along. We have on our website at the SCAN Foundation's website, we have two resources that I think one is really helpful towards this work, and that's a pricing guide that we developed that helps organizations think about the service that they're offering that they want to potentially sell through a partnership, and to determine the price, and also think about pricing strategies for these partnerships. The second thing that we've put together, which is helpful on a long-term kind of planning piece as well, is a tool that looks at sustainability for a specific program. And what this has done, and what the feedback we've received from organizations, is that as they're thinking about an existing service that they have right now, so let's use home-delivered meals as an example, they have a variety of different funding streams through grants that provide home-delivered meals. But as they're thinking about what growth would look like and what partnerships would look like, they're able to, with the sustainability tool, put in places where potential revenue sources would come from to determine the probability of those revenue sources, and be able to look at a projection across 5 years to see if the assumptions they're making about growth in revenue will in fact leave them in a positive place with funding for their projects. So those are both on the Foundation's website, and John, I'm again happy to send the links to you to send to the group.
Okay. Nora, anything to add?
I just ditto what Marisa and Erin have said. When community-based organizations do ask me where they can get more information, I turn them to the ACL, the N4A website, and to the SCAN Foundation. And I've had many people here in New York City tell me that the materials on the SCAN Foundation's website has been extremely instrumental to them in setting up their services here in New York City.
Okay. A question from a slightly different angle. Is there an expectation that software or other technology based on integration techniques that you are learning will emerge from this, particularly as telehealth is developed, to help manage the flow of services? And do you see that as part of the activities that are coming on board? I'll turn that to Nora first and then see what others have to say about that.
Absolutely, John. What I hear from the Partners in Care Foundation and Elder Services of the Merrimack Valley is that technology has become crucial in being able to deliver the services and entering into the contracts with the healthcare systems. So what is needed is an electronic health record that can be shared between the hospital and the community-based organizations. And right now, there's no good sharing of that. There's no one uniform electronic health record that they can all share. But then also what these network agencies need is also a way to be able to share among themselves, their clients, the services that are being delivered, and to be able to track them, and then to also track the billing and the coding and the cost sharing. So it's become very complex. And what these community-based organizations are looking for is additional resources in order to help fund the development of this technology and the building of it for them. So this has become a crucial area.
Erin and Marisa?
This is Erin. You know, we have, as part of our project, our Linkage Lab project right now, we had actually set aside for each of the 6 organizations some additional funds that they could apply for during the grant period for an infrastructure need. And, you know, over half of them have used those dollars for information technology, for being able to not only implement an electronic health record, but for some really basic stuff like getting new computers, because the computers that these organizations have been running with can't support the new technology that they need to use, the systems they need to use. So there's a definite need here, and I think that what we've heard from these organizations is that traditionally funders don't like to support purchasing computers or software, but it is so critical to the success of these organizations as they work with these partners.
Marisa, anything to add?
Sure. I just one quick thing first to agree with what both Nora and Erin have to say in terms of how critical information technology is to this effort in terms of communications and as well as sort of back office functions when it comes to contracting with integrated care entities. We know at ACL this is an issue that we're looking at in partnership with our with sister agencies here within the U.S. Department of Health and Human Services, such as the Office of the National Coordinator for Health Information Technology, as well as the Centers for Medicare and Medicaid Services and others. So I think we're going to hear continued conversation not only at the local level but also at the national level in terms of how health information technology can help to facilitate these relationships and how they can not only community-based organizations can sort of be brought into these electronic communications and that can help them do their work and improve the quality of care for older adults.
Great. I think we have time for one more, and then we'll have to begin our wrap-up process. And this is, I'll ask this to our foundation speakers particularly. Do any of you know of local foundation efforts, particularly community foundations or other local or regional foundations that are poised or already working on these issues? And do you have any good examples for them or references in terms of moving this work forward? Erin, do you have any local foundations that are involved?
Well, we've heard a couple of foundations mentioned earlier. I think that both potentially Marisa and Nora mentioned them. The health foundations in South Florida and in New York. In California, we've been talking with a lot of foundations. There's been a lot of interest from foundations that fund across the state to having a defined geography about the work that we're doing. But none of them have taken a step beyond the Archstone Foundation, which Nora referenced in her slide, to engage in this work. And I think that part of that has to do with that the environment is changing really quickly, and being able to determine where we as funders can have the biggest impact and help organizations in this process. So there's been a lot of interest, and we get calls all the time from our funding partners, but I'm not aware of any in California right now that are focusing on community-based organizations specifically in the way which we've described it today.
Nora?
Well, yes, as I've mentioned, we're, in addition to working with the Archstone Foundation and the Tufts Health Plan Foundation, both of those foundations focus in their states. So they've been very instrumental in helping the grantees, the Partners in Care Foundation, Elder Services in Merrimack Valley, in their own states, which has been excellent. And then the Health Foundation for Western and Central New York, has been helping one of the 9 sites that's receiving the technical assistance from ACL up in New York State in helping to provide them with funds to travel, and as well as looking at how, if they should be thinking about developing a third-party administrator to help them with some of the infrastructure and the services. And then the Health Foundation of South Florida has also been, very helpful with that site in South Florida. So I think there's a lot of opportunities for foundations of all sizes to get involved. I know that I've been speaking with Rachel Pine at the Altman Foundation, who's been, talking with the AAA here in New York, the New York City Department for the Aging, and helping them develop the business acumen skills as well. So I think that any foundation, any size, any geographic area can certainly find a way to become involved in this issue.
Well, that's a wonderful segue into a brief announcement, which is that Grantmakers in Aging will, in fact, be convening a funders group, a funders forum, for those funders who are interested in supporting this work. So we will be sending out an announcement about that, but for those of you on the call who know of foundations or other funders or are from one of those funders, please watch the GIA announcement line or contact us directly if you would. So at this point, we're unfortunately going to have to bring our session to a close and want to ask each of our presenters to give their final words to the audience as we close the session today. So Marisa, can we start with you?
Sure. First of all, thank you so much to the SCAN Foundation and the John A. Hartford Foundation for their partnership on this work, as well as, most importantly for today, to Grantmakers in Aging for putting this session together. We really value the partnerships that we've forged, not only with the SCAN Foundation and the Hartford Foundation, and welcome the opportunity to work with other funders around the country as we all engage in this important work.
Erin?
Well, I certainly echo the things that Marisa just said, and we are very excited to be doing this work, and we look forward to the future engagements with the GIA, and especially as growing the learning circle around this and working with our colleagues from other foundations.
And Nora?
And I echo my colleagues in just thanking GIA for holding this webinar and also thanking my colleagues for their partnership. I follow their lead in the excellent work that the SCAN Foundation and the Administration for Community Living have been doing in this area, and the Hartford Foundation is just so pleased to be able to jump on board and to work creatively and innovatively with our partners in helping older people and those with disabilities receive the quality care that they deserve and remain in the community.
Well, I want to thank Marisa Scala-Foley from the U.S. Administration for Community Living, Erin Westphal from the SCAN Foundation, and Nora OBrien-Suric from the John A. Hartford Foundation for their participation in today's program. We thank you for all you do to make life better for older persons. We also want to thank the John A. Hartford Foundation and the SCAN Foundation for their support of this program, as well as the American Society on Aging for their technical expertise. And finally, I want to thank all of you for participating in today's webinar. Have a great day.